sir. That was nice, man. Yeah. Ethiopia. All the health solutions are coming from Ethiopia, guys. Yeah, that's incredible, and we appreciate that wonderful participation. Now, I don't know, I had given our wonderful doctors some time to go and develop some solution, and since they are solution oriented, I don't know whether you guys are ready. You guys are ready because you already had a test of the stage. So ladies and gentlemen, for the second time on stage, let me appreciate Kacha and Saglan Wajee Hospital as they come to give their presentation. Yeah, you can beat us down, but we can't remain down. We bounce back stronger than ever before. I'm tempted to sing a reggae song. Here's your microphone, sir.
Thanks so much. 3 Ethiopians in a row, almost like a marathon. Imagine a country like Ethiopia with a population of more than 120 million people to insure 95% of its population. That is the reality of China, where I went to medical school. I always knew I was going to come back, and when I did, I wanted to make sure health insurance became a reality in Ethiopia. Next. So one of the first patients that really showed me the Ethiopian healthcare system was Mr. Haile. Haile was a father of 3, and he quit his job 7 years ago because of a very simple illness, a prostate cancer. After waiting for 7 years, he received the surgery that only took 30 minutes to change his life. Next. Haile is not alone. There are millions like Haile. Approximately 86% of the Ethiopian population does not access quality healthcare. This is because healthcare in Ethiopia is very expensive, and there is currently no premium financing to avail the expensive premium policies. Because of this, hospitals are faced with a very fluctuating cash flow because all patients pay out of pocket and all in cash. Next, please. So last year, we launched a micro health insurance package called Efoy. Efoy in Amharic means relief. Efoy. So with Efoy, you pay as small as $20 for a full medical cover except for medications, which is risk insured by the hospital. So we unfortunately became the risk barrier for all these patients. We managed to sell 1,400 policies in less than 10 months without no or little marketing. So when we were selected for the BimaLab program, we met like-minded people like us that wanted to change the Ethiopian healthcare space. For example, my friend Miki from Kacha.
Yeah, and this all started in Kigali while me and my good friend Dr. Erai sit on over a coffee and discuss on the significant partnership potential that we could bring to our country to change the lives of many. And for your surprise, we never knew each other while we living both in Addis. So, ladies and gents, allow me to introduce myself. My name is Mikiyas. I'm a manager for data science for Kacha. Kacha is a first mobile money service provider operating in Ethiopia, having an in-house built core platform, creating an interoperability among players like banks, and through USD and mobile app, we could reach the last miles through agency banking and mobile money service. So basically, the simplest way that I could explain the competition is it's a fight between David and Goliath. So we compete with the big telco giants, but it depends on how you see it. We see opportunities. So if you manage to create a partnership like us, there is a potential that we could uncover from this as well.
We believe that the Ethiopian space is big enough for a lot of players. We currently have an addressable market of more than 50 million people. The Ethiopian healthcare spending has already passed $1 billion without the much involvement of the healthcare ecosystem. We believe if the insurance component is added, the healthcare ecosystem will be valued at more than multi-billion dollars. Despite our population of 120 million people, our insurance penetration is 0.3%, much lower than the sub-Saharan countries, especially Kenya, where you guys have around 3%.
Yeah, and as a data scientist and digital financial service specialist, numbers are like music to my ears. And 68 million people have a wallet account in our country, and the government has currently started the National ID program with a motto of 1% is one, and we can leverage on top of that. So we come up with a solution called Efoy. It's a solution whereby a Kacha user, whenever he do transactions, he could pay his premium in either of three ways. One is he could pay, we could fill the financing up so that he could pay his premium now and pay us later on installment base. The other one is whenever he do transaction, he earns a loyalty points. So without any additional fee, he could pay his premium and get medical attention. And the third one is through a dedicated saving so that he could plan ahead of time for his and his family health. So he could go to the hospitals and get medical attention. So the hospitals play a key role here that one, they will minimize the level of risk by verifying that the self-declared information is valid or not. And the other one is the person who's getting the medical attention is the one who's paying premium or not. So through that, they will minimize the level of risk and moral hazard that could possibly arise. So our business model is simple: forming a dedicated health insurance backed by Kacha and hospitals, and creating a distribution channel to address the mass, like the MEC has earlier said. It's a simple channel to address the larger market, and through underwriting and through fast station fee, we sustain the business and make money. So together we envision to onboard 1 million policyholders in 3 years of time and be exemplary in digital health finance, and extend that to 10 million plus in 2035, and support the BimaLab initiative of addressing 100 millions in short period of time. So lastly, we ask BimaLab prize for the formation of a dedicated technology team and add additional 800,000 USD as a grant or interest-free loan for infrastructure, platform, scale-up, and literacy.
We believe that there are various stakeholders that have had similar experience. Here in Kenya, you have AAR and you have Jubilee that are owned by hospitals. You have Kaiser in the US that have changed the landscape of how we view health insurance. We want your experience and your guidance, so as you trailblazed Kenya, we want to trailblaze Ethiopia. You remember Mr. Hailu. We are beautiful when we smile.
And through partnership, we unlock possibilities to make life better. Thanks so much.
Thank you. Wow, beautiful. I don't know, I'm feeling lonely because somebody needs to walk just to hold my hand to do this. Yeah? Next time somebody is very quick, I will do that. But thank you very much, Kacha and Saglan Wajee. And today I've learned a new word, a new Amharic word. And the word is Efoy. Efoy. So I want you to breathe in. Breathe in. Then when you breathe out, say Efoy. All right? Can we do it in unison? 1, 2, 3, breathe in. Efoy. Some of you are specialists in holding your breath, man. We are waiting for the Efoy. All right. So ladies and gentlemen, that is the first round of pitches. We've looked at climate and agriculture, and we've also looked at gender and health. I sound so good on this microphone, man. My father, my mother, we thank you. So